This one weekend habit is significantly increasing your risk for hypertension and cardiovascular disease. Continuing my series going over AHA's new dietary guidelines, the last one, number 9, is limiting your alcohol intake. Now, the conversation around cardiovascular health and alcohol is a little bit nuanced. Many of us may have heard that 1 to 2 drinks per night can actually improve cardiovascular outcomes, including blood pressure, but these responses are largely acute or short-term. If we look at the larger span of the day, we see that blood pressure actually rises and it all balances out. Not to mention, the few studies that do see improved cardiovascular outcomes with elevated alcohol intake don't take into account confounding variables such as socioeconomic status, diet, exercise, and other lifestyle factors. There's also Mendelian randomization studies that have shown a linear, progressive, and dose-dependent link between alcohol consumption and cardiovascular disease-related mortality. The final nail in the coffin, the American Heart Association, the American College of Cardiology, the Department of Health and Human Services, as well as the World Health Organization, all advise limiting your alcohol intake to reduce your risk for hypertension, cardiovascular disease, as well as a whole host of cancers. And interestingly enough, this study was just published last year, trying to see if you could outpace the negative outcomes of alcohol consumption with regular exercise. And they did see that the individuals that chose to abstain from alcohol had the best cardiovascular disease outcomes, but they still saw a positive link between alcohol intake and cardiovascular disease. However, cardiorespiratory fitness was a greater predictor of cardiovascular disease, meaning the more fit the individuals were, the less risk they had of cardiovascular disease. So, in summary, if you're not drinking alcohol right now, don't start. If you are, try to limit it. But regardless, everyone should be exercising to improve their cardiovascular health. That's it for this series on AHA's new dietary guidelines. If you guys found it informative or interesting, feel free to drop a follow or a like. And if there's anything specifically you'd like to hear about or know the research on, feel free to drop it in the comments below, and I can post a video about it in the future.